PPE stands for personal protective equipment, and the reason why it's important is because we are in a global pandemic caused by COVID-19, novel coronavirus. That disease is caused by an infection of a virus called SARS-CoV-2, which shares a lot of similarities with SARS. This time is different though. The R0, which is the transmissivity factor, is around 2.8, which means for every one person who gets it, they're going to infect 2.8 people. And that's excluding super spreaders. So that's why it's so important for us normal people to shelter in place and practice social distancing and to wash our hands. And if we don't have access to water at the time, use alcohol-based hand sanitizer. Has to be at least 60% alcohol based. Okay, so what's the big deal with why I've created this new design of surgical mask? Well, really it's because one, I started noticing that my friends who are healthcare professionals were not getting timely shipments of their orders, and they had been following COVID-19 for a long time. So they weren't getting regular shipments, and shipments were being canceled. And not only that, but prices were just rising and rising. So I just talked with a chemist in Pakistan, and they actually have to pay an equivalent of 50 cents per piece for these disposable masks, and that's really expensive over there. Here, we're paying like $70 for a pack of 25. So that's over $2 a piece for not even N95s. Because N95s, you'll pay anywhere from $10 to $40 a piece or above. I actually paid more than $40 per piece of N95 equipment so that friends who were intubating patients would have something more than a surgical mask, because surgical masks only provide limited liquid barrier protection. They don't protect against aerosolization. So, but N95s are difficult to make, and I'm going to be working on that next. For now, this is what I've come up with. This one costs 40 cents per piece, and we're not using the elastics because in my maker groups, elastics were really in short supply. And because surgical masks are in short supply, but they're being more we're going to rely on them more than N95s, which are impossible to get. I wanted to at least have some sort of improvement on the bacterial filtration efficiency and particulate filtration efficiency as compared with the traditional 3M masks, which are under 95%. So some of them have like penetration of up to 10%. So I came up with this one, which has 3-ply, and I went through a whole bunch of different surgical fabrics, and it has that melt-blown layer, and in testing we found that this one was able to filter for bacteria at 99.1% and for particulates 96.5%. So the lady at the FDA named Cynthia was able to kind of like give me the guidance to be adherent to federal law under the issuance of that it was a medical purpose mask that wasn't intended for high liquid protection. And then soon afterwards we did further testing that was required, and so now we're in the process of being formally FDA approved. So that's on the website. We have an operator number and a device list registration pending. So that's really cool that we could add another approved design to the market in order to alleviate the impacting that just supply chains have seen for PPE. And the cool thing about this design is not only the improved face seal leakage design, so you have a flexible concealed nose bridge piece, because you want to prevent as much of the liquid from your breath to come out, because it has bacteria and you could contribute to co-infections, which are being seen, which is why one of the drug combinations being studied is plaquenil and azithromycin. I'm actually a scleroderma and lupus overlap patient, so I'm supposed to be on plaquenil pretty regularly, every day. And since I can't get a refill, I'm rationing myself to every other day, because there's no plaquenil that we can access. That sucks too. Separate story. And then in addition, improved face seal leakage design is going to help so that the virus doesn't penetrate through these kind of loose fitting areas that are weak points. So that's another cool design feature. The next design feature is that I had noticed, because I was following for a long time, one of the major problems of both hospitals in the US and also hospitals in the early outbreak areas in Asia were that you didn't really know if your face mask was used or not, and so hospitals can't take used product and they don't know which products used, so it ends up being a lot of donations actually don't get used or can't be accepted, and that's because they want to keep their healthcare professionals safe, and you can just think if that's counterproductive or productive or not, whatever. But I came up with a design that eliminates the need to use up precious elastics from that the other manufacturers do demand, and also help you be able to tell if your mask has been used. This one has not been. And you just see the demarcation lines that you would just pop out for the ear loops. So this one's new. This one is all crumpled, but clearly it is used because the ear loops have already been popped out. So another design feature that adds value. So we have cost. It's cheaper to make. It's cheaper than it even costs in Pakistan. 2, increased effectiveness in bacterial and particulate filtration in comparison to the traditional surgical mask design. 3, the concealed nose piece that improves face seal leakage. And 4 is eliminating the need for elastic, which is a dwindling commodity that's being used for PPE, and also being just intrinsically anti-tamper because of the demarcation of the somewhat elasticized surgical fabric. So those are 4 improvements that I worked on, and yeah, I hope that it provides some value in this really crazy time. More projects next, but this is the first one for now, and yes, it's being green lighted by the FDA, and we also have a device registration listing number that's coming up, so that is pretty cool, because then I can at least feel assured that what I'm doing is actually protecting my friends, which was really the big goal of this, was to give them protection and also some peace of mind. So thank you for watching, and I hope that some of it was valuable to you, and I hope you guys stay safe and stay healthy, shelter inside, don't go out unless necessary, and wash your hands.